Welcome to the place where we gain knowledge through the lens of creativity. I am Aaron Dworkin, and this is Artful Science. Thanks again for joining me here on Artful Science. Today's show is Sugar Hill, Understanding Diabetes. And my guest is Dr. Kelly N. Wood, who's an internal medicine physician, board certified in endocrinology, diabetes and metabolism, and is currently in clinical practice in Atlanta, Georgia. Dr. Kelly, welcome to the show.
Thank you for having me. I'm really excited about our discussion today.
Oh, well, thank you so much. And of course, in addition to all of your actual medical practice, you're an author and just deeply dedicated to key issues in health and obviously health equity. So this would be phenomenal to be able to talk with you about an issue that is so important across our entire society, across the world, but especially in communities of color, and that is diabetes. And so what I wanted to just start off with is because while many people have to battle with various challenges of diabetes, I find when I hear it come up in conversation, a lot of people sometimes even disagree about what kind of it actually is. And whenever I kind of say, so, well, what is actually diabetes? A lot of times people are like, diabetes, and so wondering, because this is where what our show is all about, could you kind of share what is actually diabetes? What's happening to our bodies?
Great. So people talk about having a touch of diabetes or a little bit of high sugar. That's not a thing. There's no touch of diabetes. Once you have it, you have it. So first thing, we got to talk about insulin. Insulin is the hormone that gets your glucose or your sugar from your bloodstream into the cells. And your cells use glucose as its main energy source. The brain only uses glucose as its energy source. That's why when you get hungry, you kind of, personality changes, you kind of, you get hangry,
so this is
right?
I'm being hangry. I'm hangry.
Exactly, you're hangry. So insulin, you can think of insulin as the key that unlocks the door to get the glucose from the bloodstream into the cells. So in diabetes, there's either an absolute lack of insulin, as occurs in type 1 diabetes, or in type 2 diabetes, the key doesn't work anymore. So there's a level of insulin resistance. There's insulin around, but it's not working. So what this does is that this allows the sugar or the glucose to build up in the bloodstream and not reach the cells where it's needed for energy.
Gotcha. Awesome. Well, of course, that's so really in some ways, because a lot of times we name the show related to, sugar and all those things, but it's really our ability, the insulin, and how that is able to incorporate sugar in our bodies.
Exactly. And that's why, as endocrinologists, I'm a hormone specialist. That's why diabetes falls under our wheelhouse, because insulin is a hormone.
Gotcha. So to kind of go a little bit further, and I know, especially in, a lot of the arts communities that I'm a part of, when we think about or we talk about diabetes, a lot of times people talk about, well, you got that because of your diet, all right? And they're like, because you eat that's why you ate too much sugar. I love, certain things. My sweet spot, so to speak, is cookies. I love eating cookies at night while watching Netflix. And so is there truth to that, and or is our diet completely responsible when we end up with diabetes or not? Or how should we really think about that as far as the science behind it?
So our discussion should really be around type 2 diabetes. Type 1 diabetes usually happens in children and adolescents, and that is a purely genetic condition. So there are no modifiable risk factors like diet for type 1 diabetes. For type 2 diabetes, there are modifiable and non-modifiable risk factors. So age is one non-modifiable risk factor. Age over 45 increases your risk, as well as having a family history of diabetes. If you have if both your parents have diabetes, you have a 1 in 2 chance, which is like 50% chance of you yourself going on to have diabetes. So
Wow.
in terms,
And just because I just want to make sure I wrap my head. So regardless of, I could just eat, whatever perfect food would be, only salads or whatever. But if both of my parents have diabetes, I'm going to be at that 50% potential mark regardless.
you start off at that 50%, but you can make lifestyle changes or work on those modifiable factors to reduce that risk. And diet is one of those factors. Obesity is a big risk factor for having type 2 diabetes. So obviously keeping your weight within that normal BMI. About 50% of the African-American population in America is obese. So we really need to work on those risk factors. Being active, exercising. Recommended amount is a minimum of 150 minutes per week. Making sure that you keep up with your regular checks from your doctor or things that you can do. But the main modifiable risks would be, keeping your weight down, watching your diet, limiting the amount of processed carbs that you have, as well as being more active.
Right. And just when you just shared that statistic that 50% of our community, of the Black community, is obese in America.
Yes.
I've always known that it's an issue. And so maybe this kind of ties into the next question I wanted to ask you, and maybe it's in part answering it, but that's, it seems like there's higher rates of diabetes in the African-American community. And so is there any kind of racial predisposition related to diabetes and being African-American, or is it because there is a predominance of certain other risk factors that then cause it, such as obesity?
It's very multifactorial. I actually had the stats that can give you the exact numbers. So in terms of the percentage of US adults with diabetes, it's about 12.1% in Black population as opposed to 7.4% in white non-Hispanic population. Hispanic and even American Indian and Asian population is higher than our white counterparts. So there's no one gene that causes diabetes, but there is a genetic predisposition for diabetes in the Black community. Some of it has biological factors like how we produce insulin, the fact that we might have more deposition of fat around our midsection compared to our white counterparts. Then there are also social determinants of this as well, like food deserts. Are we given access to the same quality of food, the same types of food? Poverty also plays a role in this. Access to healthcare, healthcare bias. Black population are at a higher risk of having diabetes complications, such as ending up on dialysis. You go through some of our communities and you see a dialysis center on every block, right? We're more likely to have eye issues, to have lower limb amputations from diabetes.
Gotcha. And so, while I think there are some of these systemic issues that I feel I know, myself or members of our audience feel like, okay, I'm not going to be able to change the food deserts and the systemic disparity of what happens to my community and those types of things. But of course, there are the things that we can, and so that at least can help our odds, our percentages, even despite the systemic disservice that is occurring. What would you say is either the top one or top two things that I can do as an individual, that I'm empowered to do, so that I can at least minimize my risk as much as possible?
I would say make those lifestyle changes. If you fall into the overweight or obese category, try as much as you can to get your weight down. And you don't even have to lose like 30, 40, 50 pounds. There was one study that compared a very popular drug called metformin to lifestyle modifications in terms of preventing someone going from pre-diabetes, which is called borderline diabetes, to full-on diabetes, and the lifestyle arm did better than the medication. So it's really powerful stuff. So what they did was they exercised at least half an hour, 5 days a week. That's a minimum of 150 minutes per week. If you can't do that, just start off with walking 15 minutes in the evening after dinner. A lot of us, are sedentary after we eat. Also cutting down on, and one thing about exercise is that I think it needs to become done as a family. A lot of our kids are having type 2 diabetes before they even hit 15 or 16. So as a family, we need to normalize activity. And the second thing is really cutting down on the processed foods, the sweet stuff, the white flour stuff, like the pasta, the breads, really working on cutting your carbs down. Those are some simple things that you can do, even cutting soda out.
Yeah.
One simple thing you can do, drinking more water. So taking care of yourself in general will help to reduce your risk.
Totally. Well, this is all just so informative. I know for myself, one of those big things, because with just my schedule and the way that I am, I can't get to the gym or do these things. And so I ended up with a treadmill desk. And so that was the only way, is I can just, if I'm there, I've got to do my work anyway. If I'm standing, I might as well walk. And that at least helps, to get me in that walking phase. Well, this is really, really just, I think, powerful information for us to have. We're almost out of time, but I always like to ask of our guests here on Artful Science. We're here at the intersection, right, of the arts and sciences. Just curious, do you have your own artistic practice that you do at all? And or is there an art form that you particularly love?
So one thing that I do, which is a release for me, a way to connect to myself, is writing. And this is not medical writing, but writing about life, writing about my experiences. So that is one thing that I do.
Oh, well, that's awesome. Dr. Kelly, thank you so much for helping us gain knowledge through the lens of creativity here on Artful Science. We appreciate it so much.
Thank you.